Illnesses that cause dementia primarily cause memory problems, and then they cause problems with some other aspect of brain functioning. So they may cause problems with what's called executive functioning, which is planning and organizing thoughts, or they may cause problems with language, or they may cause problems with reasoning. There's a whole range of difficulties that happen with dementia, but the primary way to make the diagnosis is based on memory loss. The most common cause of dementia in this country is Alzheimer's disease. And Alzheimer's disease causes about 2/3 of the dementia in this country. There are increasing, unfortunately, numbers of people who are developing Alzheimer's disease, in large part related to the aging of our population. At age 65, about 10% of people have diagnosable Alzheimer's disease. At age 85, 40 to 50% of people can be diagnosed with Alzheimer's disease. So this becomes a very common problem as people age.
Alzheimer's as a disease is kind of like the layout of a city, a map. I mean, you have all kinds of different ways to get to a certain place. Let's take the capital in Madison. I mean, you can go from the east, the west, the north, and the south, and you can take different ways and snake around it to get there. And the mind is like that. The mind, you have all kinds of different pathways that the mind can take to get to an answer, whatever that answer might be. And as Alzheimer's progresses, those particular pathways, one by one, get shut down. So if you're looking to get to the capital, maybe the north and the south ways of getting there are shut down, but you still have the east and the west. But over time, Alzheimer's cuts off those connections, plugs up, stops the communication from going, and soon you're down to maybe one route. And then on a bad day, you're struggling to figure out how to get to the capital. And then eventually that shuts down, and soon that you no longer have that problem-solving capability in that particular area.
Well, we know that there are two basic processes that happen with Alzheimer's disease. One is that the nerve cells themselves get tangled up, called neurofibrillary tangles. And then there is a protein called amyloid that gets deposited in the brain that further causes deterioration of brain cells. But we don't understand why that happens and how to prevent that from happening. And so that's the primary research that's taking place now, is how do we prevent the process that starts this illness.
Well, the difference between just aging and memory loss is I forgot where I put my keys. That's aging or memory loss. If I take my keys out and say, what are these? I don't really know what those are. That's not aging and memory loss. That's some disease underlying that particular problem, which could be Alzheimer's.
Memories that are long-term memories are lost last with Alzheimer's disease because they're already there. What Alzheimer's starts to do is it affects the ability to form new memories. So particularly recent memories are the ones that are lost first. So if I ask somebody to feed back 5 digits, they could probably do that. But if I ask them 2 minutes from now, they may have forgotten that I even asked them to remember 5 digits. So it's that short-term memory that goes first. And so the new memories never make it into long-term memory. But the ones that are already there stay there, so those are lost last.
The last really great conversation I had with her, I didn't understand a single word that she said. I mean, she was mumbling, basically talking in another language that wasn't identifiable by anybody. But she was having a great time, and she had a smile on her face, and I just kept saying, "Oh, really?" And she would just go, blah, 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 you know, just be going on, and this big smile, and she was so happy, and she was, I think, reliving something from when she was a teenager or a child, because as one of the things that I noticed, and that you tend to notice with people with Alzheimer's, is they have a regression, historical regression. They lose their most current memories first, and gradually over time they go backwards. Towards the end of when my mother was at home, she would tell my father, "It's time for me to go. It's dark outside. I need to go home to my father." She'd been married to my dad for 30-some years. She'd been living in the same house for 30-some years. Her father had been dead for 40 years, you know, and yet she wanted to go home because she didn't want to leave the impression that she was staying after dark at her boyfriend's house. So, I mean, those are all things you have to come to grips with, and the biggest piece of advice is that I would have is you can't change the person.
The Wisconsin Registry for Alzheimer's Prevention is a longitudinal study of adult children of persons with Alzheimer's disease. And the goal is to promote or discover ways to identify the disease earlier than what we normally do, and eventually to prevent it.
RAPS is the Wisconsin Registry for Alzheimer's Prevention, and it's a program that's run by the University of Wisconsin Medical School, and asks for volunteers from the community from all over the state who have relatives that have died from Alzheimer's.
I drive from all over Wisconsin. Many of them are coming back for a second time for a half day, really, of testing. And they do so because of their experiences with Alzheimer's disease in a parent, and their desire to learn more about how to prevent this disease and identify it early.
I want to try and make a difference. Obviously, I had a close family member that suffered and died of the disease, and I'd like to see a solution, a cure, a diagnosis be able to take place so that people with Alzheimer's can be tended to and maybe cured at some point in time.
What we need to do is to follow people over time and to look for changes. And so just about everybody in this study has participated in one wave of data collection. We are now beginning the second wave of data collection in an effort to see whether or not there have been changes that have occurred. And of course those changes may or may not be suggestive of Alzheimer's disease, but we can begin to look at the factors or groups of people who may have certain characteristics that place them at an increased risk of showing declines in cognition, poorer memory over time. First of all, we know, and we knew previously, that Alzheimer's disease is not just a disease of old age. The disease is recognized at advanced stages in older adults, but it occurs and develops over a period of time, maybe decades, before someone becomes symptomatic. I think what we didn't expect was to find that family history is a unique risk factor. We actually thought that the family history risk of developing Alzheimer's disease was due in large part to this ApoE4 gene. When we do our analysis looking at people who do and do not have the gene, we find absolutely nothing. But when we compare people who have a family history without a family history, that's where we begin to find changes. And what it means is that family history has been a long neglected risk factor for Alzheimer's disease. And for the first time, we are now systematically studying it and know that this population is the population that we need to study, need to involve in this project, and to need to help out early. One of the earlier symptoms is short-term memory loss, and people can remember what happened decades ago but can't remember what happened a few minutes or a few days ago. And if I were to be concerned about a parent, for example, I'd be concerned if my parent was losing skills like cooking, driving, getting lost while driving, forgetting to prepare meals, neglectful as far as taking care of themselves, not able to manage their medications, not able to go to the grocery store and fill out a grocery list. So there are a whole host of early signs that are warning signs. We're looking at a variety of risk factors that place people at risk of developing Alzheimer's disease, with the thought that if we understand the risk factors, then we can eventually develop an intervention to prevent the disease. And one way to think about this, if we could delay the onset of Alzheimer's disease by even just 5 years, we would dramatically reduce the number of people at risk in the future. Because this is a disease that manifests itself in people who are 75 or 80, a 5-year delay is almost like a cure. What we know is that what's good for your heart is also good for your brain. So it's exercise, maintaining your weight, staying away from fats, a modest amount of red wine, anything keeping your cholesterol low, controlling your hypertension, managing your diabetes. All of these are known risk factors for Alzheimer's disease. And what's important is that managing these risk factors at midlife will definitely reduce a person's risk of developing Alzheimer's disease down the road.
I try to make sure that I get plenty of physical exercise, take on new challenges, keep my mind active, constantly try and solve problems, whether it's at work or at home. And having 3 kids at home and a job that takes analytical skills, that happens quite frequently. But you know, I just try and remain active, biking, hiking, doing the Ironman last fall, you know, things like that.
I think that the most important thing for people to remember and to learn about this disease is that it truly is preventable. It's no different from heart disease. Decades ago, millions of people died from heart disease, and we made dramatic strides in understanding the disease and preventing it. We're on the verge of doing that with Alzheimer's disease as well. It's just going to take us a little bit longer because it's been ignored for so long.
My hope that the current rate of research and involvement of others in research programs nationwide is going to cause a cure or a diagnosis to be found for Alzheimer's, and that ultimately it's going to impact maybe not me in my lifetime, but certainly my children in their lifetime.